Are there alternatives for sleep instead of Advil PM? There's a lot of alternatives that are non-prescription. Magnesium glycinate. Do not get magnesium oxide. Magnesium oxide is what we use for constipation, so you're going to get diarrhea from it. And if you want that, that's fine. Then go ahead and take the magnesium oxide. But magnesium glycinate does help with sleep. I have had patients tell me that anti-inflammatories such as Motrin or ibuprofen does help with sleep. So you could use that. I just don't like people taking that regularly because it can really be hard on your stomach. If you're in a state that has legalized THC, the gummies that are out there that have CBD, but there's a special CBD, it's CBN. That's the drowsy one. And it has minimal THC in it, about anywhere from 1 to 2.5 milligrams. And there's fast acting gummies now that act within 20 minutes. I can tell you, I take that rarely, especially when we're traveling. And it says it should act within 20 minutes, but in my body, it takes anywhere from 20 minutes to an hour and a half for me to notice the effect. So with any gummy in the THC department, you just have to try these things out and see if they work. And the brand that I've usually used, it's the only one they carry at our dispensary, is Wild, W-Y-L-D. So magnesium, Benadryl, CBN, and then melatonin. People will take also for sleep. Melatonin can take up to an hour and a half to kick in. So if you want to use it for sleep, I would tell you to take it at least an hour before you're actually getting into bed. And as with any supplements, yes, go over it with your physician. But number 2 is make sure the supplement has in it what it says it does. And there are websites you can go to. If I'll post at the bottom different websites that have actually studied the different brands to make sure that these supplements do have the actual ingredient that they say they do. Because I can tell you with melatonin, I've found a lot of different supplements that don't work at all. The best one I've ever found for me is the Costco brand, to be honest with you. And staying at a low dose, 1 to 3 milligrams a day. Anything above that into the 5, the 10 milligram dose, some people can find it to work opposite and be activating rather than causing you to go to sleep. Again, melatonin is very long acting like Benadryl, and so it can leave you with a hangover in the morning. So my recommendation is try magnesium first. And you might, if you're in a state that has legalized THC, try one of those gummies because those are very short acting. And then if those aren't working, then try the Benadryl or the melatonin, and then talk to your doctor and work on your sleep habits. A big habit for me is I always brush my teeth right before I go to bed. I get in bed and I read. I turn off the light. I put on my eye mask. We talked about it in another session about where I do tape my mouth, and then I turn off my light and turn my CD player on. My phone is nowhere in my room because it has ambient light that your eyes can pick up. And any light that your eyes pick up, even if you're not seeing it, will decrease your own natural production of melatonin. So by doing that, and that's what I do every night before I go to sleep, I've created a habit. My body will start secreting, the neurons will start acting because it knows what I'm trying to do. And that's why it's so important to have a sleep habit. They call it sleep hygiene. I hate that word, but just good sleep habits that you do routinely every night. So the minute you start with your routine, your body goes, I know what she's trying to do. And it puts you into that sleep mode.